Another thing to think about as far as educating people is educating them about cancer signs and symptoms to promote early detection. So I mentioned about how this contributed to breast cancer early detection. If people feel pain, nausea, pruritus, vomiting, dysphagia, weight loss, abnormal organ function, sudden onset diabetes, a lump or swelling, fatigue, lethargy, jaundice, discoloration, loss of muscle or fat, called cachexia. Okay, all of these are signs, and we can let people know that if they experience some of these symptoms and it's not explained, it might be cause for investigation. Another good news, there are increasingly promising methods in preventative detection. So in blood detection, there's circulating tumor cells, which can help detect prostate cancer, breast cancer, malignant melanoma. Circulating tumor DNA, which can be a sign of colorectal cancer, non-small cell lung cancer, ovarian cancer. Extracellular vesicles can help detect ovarian cancer, prostate cancer, and malignant melanoma. There are biomarkers which help detect there are biomarkers which help detect metastatic. There are biomarkers which help differentiate metastatic from non-metastatic breast cancer, reported by Yu and colleagues in Molecular Cancer 2022. And they report Lee and colleagues as saying that exosomal ephrin A2 was superior to the prostate-associated antigen, PSA, to distinguish malignant from benign prostate cancer. Next, in blood, they can look for the microRNAs that I mentioned earlier to help detect colorectal cancer, as well as breast cancer. And these can be looked also in the urine. It's even possible to use saliva to help detect oral squamous cell carcinoma. The Gallery methylation and blood-based multi-cancer early detection system assesses for cell-free DNA sequencing to predict source of origin, has 88.7% accuracy, detecting over 50 cancer types. It's very promising. This could help prevent 26% of all cancer deaths upon clinical implementation. Potential harm is low, given the low rate, just 0.5% of false positives. And I mentioned some of the stool tests when I discussed colorectal cancer, fecal occult blood testing and the others. So some of them are actually like the Cologuard I mentioned. Some of them are becoming very effective, and people can receive them in the mail and make use of them, and then follow that up if indicated. Health professionals should use a multidisciplinary approach to address addiction and lifestyle changes. The U.S. Preventative Task Force recommends addressing issues, body weight, tobacco, alcohol use. Okay, that's why we can use those diagnostic tools that I mentioned earlier, right? When people come, every time someone comes, we can talk with them and assess where they're at and how they're doing. What kind of conversations, what kind of follow-up conversations we need to have. We can discuss and consider what kind of changes are necessary. We can seek help from the multidisciplinary team, from psychologists, dietitians, other specialists. We can consider receiving support from organizations such as Alcoholics Anonymous, support from family, friends to address the social environment. So the question is, how might they all be supportive? And of course, the answer should be clear through education and training. For example, if everyone around is smoking or drinking, then it might be hard for a person to quit. If there's a lot of support for that person, then it might be a lot easier. So the U.S. Preventative Task Force recommends screening for obesity, having those conversations, referring people to assistance, okay, supporting people, education, enlisting the help of family and friends. Hopefully some of these ideas have been helpful, and like I said, you're most welcome to continue a conversation and talk further. Bye for now.